Robotic knee replacement FAQs. Your questions expertly answered. How long does recovery take after robotic knee replacement? Patients often start walking within a day and typically resume normal activities within 4 to 6 weeks, thanks to the precision of robotic technology. What is the success rate of robotic knee replacement? Robotic knee replacement boasts an excellent success rate, enhancing accuracy in implant placement, which improves joint functionality and longevity. How long will robotic knee replacement last? A robotic knee replacement can last 20 years or more, thanks to precise alignment and placement of the implant. Can robotic knee surgery be performed as an outpatient procedure? Many patients are eligible for robotic knee replacement as an outpatient procedure, allowing them to go home the same day. How much will knee bend after robotic knee replacement surgery? Post-surgery, most patients can achieve about 120 degrees of knee flexion, which is sufficient for performing everyday tasks and most recreational activities. Have more questions? Get the right answers. Schedule your consultation.